Start with the name of Allah, who is the most beneficent and most merciful. My name is Maiza. I am present the topic Brachytherapy. Contents, definition, types, disadvantages, advantages, uses, conclusion. Start with the definition of brachytherapy. A type of radiation therapy in which radioactive material sealed in needles, silk wires or catheters is placed directly into or near a tumor, also called implants radiation therapy, internal radiation therapy and radiation brachytherapy. There are the three types of brachytherapy: low dose rate implants, high dose rate implants, and permanent implants. First of all, explanation of high dose rate brachytherapy. High dose rate brachytherapy is also known as HDR brachytherapy or temporary brachytherapy. It is a type of internal radiotherapy. It involves inserting thin tubes into the prostate gland, a source of radiation, then pass down the tubes into the prostate for a few minutes to destroy cancer cells. The source of radiation is then removed. So no radiation is left in your body because the radiation is put directly into the prostate. And the low dose brachytherapy. A radiation therapy treatment for cancer that involves the replacement of a radioactive material directly inside the body, in or near a tumor, for a specific amount of time and then withdrawn in LDR brachytherapy. Basically, low dose brachytherapy is a serious and they are very expensive and they are permanent brachytherapy. And the low dose rate brachytherapy is a temporary and the low dose rate brachytherapy is a permanent and is very difficult. The patient is treated with the low dose rate of brachytherapy for hours at a time. Brachytherapy remote afterloading methods, low dose rate cesium pellets or iridium wires, treatment 1 to 3 days, high dose rate cobalt 16 pellets, iridium 192, 10 Ci source, treatment in minutes, pulsed dose rate iridium 192 to 1 Ci source, treatment 1 to 3 days. And the afterloader high dose rate high in HDR, stripping iridium 192 source 192 source 10 Ci and the 200 plus applications for body site specific treatment and programmable variable source, uh, positioning waste steps and dwell times, short treatment times minutes, long treatment minute times in days and hours, and short treatment times in minutes. Basically, brachytherapy increased the 9-year success rate from 60% to 83% for those with intermediate to high risk cancer. The overall outlook for people with prostate cancer, regardless of treatment plan, is excellent. And the afterloaded low dose rate LDR, cesium spheres and iridium wires. No real optimization possible. Long treatment times. Well known radiobiological and late effects. Treatment by location. There are the some parts of body. Look at interactivity technique, intraluminal technique, interstitial technique, surface applications, and breast. There are the some important cancers like eye, eye cancer, breast cancer, neck cancer, head cancer, and use the treatment of Brachytherapy. Brachytherapy components. Some components show planning system, remote afterloaders, imaging devices, body site specific applicators, and nucleators. There are some disadvantages of brachytherapy, hazards of radiation exposure, potential patient hospitalization, only local treatment, special skills and training are needed, silencing and redationing needed, complete coverage of target volume is essential, surgical triage in the case of interstitial techniques. And there are some disadvantages of brachytherapy. Basically, such effects of brachytherapy can include swelling, brushing, bleeding, or pain and discomfort at the spot where the radiation was delivered. Brachytherapy used for gynecologic cancers or prostate cancer can lead to short-term urinary symptoms include continence or pain or urine because the brachytherapy is very expensive and very painful, uh, very painful. That's it is not very common. Uses of some advantages of brachytherapy: higher local control due to higher dose to target volume, less dose to surrounding tissue due to sharp fall of radiation dose, high treatment dose delivered to the center of the tumor, which is more radiation resistant, more comfort treatment due to stepping source technique. Uses of brachytherapy. Brachytherapy is type of internal radiation therapy that is often used to treat cancer of the head and eye. Brachytherapy is a type of internal radiation therapy in which seeds, bones, and capsules that contain a radiation source are placed in your body in or near tumor. There is some conclusion of brachytherapy. The recent advent integration of sophisticated radiation planning and imaging modulates has improved the quality of brachytherapy treatments, allowing for more comfort radiation delivery. Brachytherapy is an effective therapy for many types of cancer, and there are some benefits of brachytherapy. Uh, Thank you very much.